Welcome to Family-Centered Care through the Lifespan course. We are Group 2 and we will be presenting our family, the Ferreira family. The Ferreira family is an extended family type and a median-class income household. The Ferreira family lives in a 2-story semi-detached home in Scarborough, Ontario. The house has a 3-bedroom and 2 bathrooms with a basement. Karen came to Canada 20 years ago as an immigrant with her mother Maria and father Ramon. Later on, she met her husband Tony and had 3 children: Lucy, Georgia, and Tony Jr. The family is a mix of Filipino and Portuguese cultural ethnicity background and a Roman Catholic. Karen and her family go to church occasionally when they get the chance to be all together on the weekends. Her mother Maria was a religious and devoted Catholic. Karen and her mother were both volunteers at the church, and Karen does volunteer work at the community center together with her friend, Evelyn. On a rare occasion, Karen brings her parents with her to the community center. The family structure: Tony, 52-year-old, father of 3 children, working as construction worker at a construction company. Karen, 45 years old, mother of 3 children, works full-time in a long-term care facility in mid-downtown as a personal support worker PSW. Lucy, 17-year-old female eldest daughter, studying at Ryerson University, a part-timer at Starbucks. Georgia is a 14-year-old, middle child, in grade 10 and studying at General Crera Catholic School, has passion in drawings. Tony Jr. is a 12-year-old, youngest in the family. He is in grade 7, athletic and a hockey player in the same school as Georgia. Ramon is a 75-year-old, father of Karen. He is a retired forklift operator at DHL Company. Maria is a 68-year-old, wife of Ramon and Karen's mother. She is a retired nanny working from family. Evelyn Nunez, 43-year-old, she works as PSW in the same long-term care facility with her best friend Karen. Current health status of each member of the family: Tony has a history of DM type 2 from his mother's side and was diagnosed with type 2 diabetes and arthritis a couple of years ago. He is on medication for his diabetes and arthritis. However, he tends to forget to take them on time, and sometimes a day can go by and he won't be able to take his medications. He is overweight and likes to drink carbonated beverages, can go through 3 to 4 cans a day, and also drinks alcohol on occasion. Due to his arthritis, which bothers him a lot whenever it flares up, he went from working full-time to part-time. This has been very concerning to him since he was supposed to be the breadwinner of the family, but now, he is earning less. Karen is the caregiver not only at work but in her whole family. When Tony shifted to part-time, she also took over as the breadwinner of the family. With her nature of work as PSW, she has overworkload and tends to get burnt out at work. She sometimes experiences back pain and sore legs after a long day at work. Her cholesterol level is a little above normal and she is on medication for maintenance. She likes to eat at fast food chains, but she eats vegetables and fruits as well. She cooks and prepares food for the family and looks after her kids, husband and parents. Ramon has hypertension even before he migrated to Canada. With a history of hypertension on his father's side, he is currently taking maintenance medication for his blood pressure. When he was in his late 60s, he noticed that he kept forgetting and remembering things. He gets easily agitated and sometimes cannot control his emotions, and he was later on diagnosed with dementia. Maria has hypertension but is controlled. She was diagnosed 5 years ago and is taking medication for maintenance. She now spends most of her time taking care of her husband since being diagnosed with dementia. She also has minor ailments like knee and back pain, but she can manage on her own. Lucy is 17 years old and she studies at Ryerson University. She is immersed in her college life, studying and other extracurricular activities. She is also working part-time at Starbucks in order to help herself with tuition and school and personal expenses. She is a timid person and sometimes self-conscious and worries about what others think. She helps with taking care of her siblings and sometimes looks after her grandparents. She had a boyfriend that she loves dearly and they were together for over a year when they suddenly broke up. That made her devastated since she was ghosted by him, cut off suddenly without any goodbye or any explanation. Due to the recent events in her family, from her dad's recent diagnosis and shift from work to her mom barely supporting her financially, adding to it is the pressure from her studies and frustration from her recent breakup, she was later on clinically diagnosed of clinical depression. Georgia's 14 years old and is currently in grade 10 and studying at General Crera Public School. She doesn't have any health issues and is healthy physically. She is an easygoing person and loves her mom so much. She is into arts and has passion in drawings, and she has outstanding grades in school. She likes attending extracurricular activities in school. She sometimes has conflicts with friends like any other teenager and later on managed to resolve them. Tony Jr. is 12 years old and the youngest in the family. He is in grade 7, athletic and on a hockey team in school. He was diagnosed with ADHD when he was 8 years old. He can sit for a long time and get impulsive most of the time. He easily gets distracted and gets off tracks. Tony's illness started and he's unable to work full-time as he used to. The pressure of the family responsibilities has now fallen on Karen, his wife, who is also the principal caregiver. He feels that he was useless. Tony had an incident of glucose drop and started to feel weak and had blurred vision and then suddenly just lost consciousness. Karen had to call 911 and he was brought to the hospital. Lately, Karen has been exhausted with all the happening their lives, frustrated and overwhelmed as she barely has time for herself. All she does day to day is go to work and come back home to be a caregiver again to her husband, aged parents and children. She seems to have no break. Her social life is affected. She barely recognizes herself again. The most help Karine gets is from her friend Evelyn, who sometimes comes to help her with her houseworks and sometimes financially as well. Recently, Tony's junior, the class teacher, invited Karen and Tony. It was revealed to them that for the past consecutive days, Tony Jr. had an embarrassing incident in school which concerned the teachers so much because the kids seemed to be very anxious lately as well. Lucy, despite being the elder sister, was able to vent to Georgia, her 14-year-old sister, who encouraged her to seek help since Lucy seemed to be very scared in consulting for help due to the stigma of having a mental illness. She later on decided to open up to her mom as well, afterwards went to see a specialist. She is currently undergoing therapy. Ramon, having hypertension and dementia, tends to get confused most of the time. He feels annoyed and angry with her wife and with other people. His emotional response often changes and have less control over his feelings and he can't express himself. Karen decided to speak to a psychologist at her place to unburden herself and it really helped. She took all what she was advised into consideration. She has joined a support group and also encouraged Tony to join a peer support program too, which he is now always looking forward to and has really helped him. Tony was able to apply for a disability in his place of work and the financial issue in the family is now relieved. The family has now learnt to face their emotions and are able to manage their situation now, as the situations and issues in the family have started to lighten and resolve. The well-being of a family is also a factor influencing socioeconomic status. This is a dual-directional relationship. Both the health and the socioeconomic status of a family influence each other. A downturn in one factor up to a critical level can derail the whole family from its personal goals. If the health, whether mental or physical, is not up to acceptable limits, it drains the family savings and family time, as well as affects interfamilial relationships. On the other hand, if socioeconomic factors such as income, occupation and education go against the family, it adversely affects their health by directly influencing the nutritional intake, owing to lesser money available for keeping a healthy diet. The factor of occupation of an individual member influences his time devoted to the family. In the long run, if the socioeconomic conditions stay bad, such as low income, less education and unsatisfactory occupation, it pushes the family towards mental health issues, nutritional deficiencies, internal breakdown of relationships, social isolation and increased internal conflicts. Criteria of demonstrating manners. As a nurse, showing a positive attitude towards the patient, which is the family during the initial interaction, is important since it is where a relationship of trust begins. Taking note about the openness, reluctance and willingness to interact must be taken into careful consideration that will later on help in unfolding the family's story. Kindness. In all kinds of relationships, kindness just makes it easier for a relationship to have a smooth flow. Showing intentionality and sincerity towards words spoken is a way of showing it. Courtesy and politeness. A simple way of showing courtesy and politeness towards the family is making them feel heard and understood, making them feel counted and valid as a member of the team or the family. Respect. There are a number of ways to show respect towards the family, although one must taken into consideration is the way of communicating with the family. Psychosocial considerations. Tony. Feeling of emasculation, depression due to inability to provide. Karen. Work pressure, lack of family time and sudden change of responsibility. Lucy. Non-availability of her mother to share her experiences could worsen her fragile stage of development in her later teenage. Tony Jr. ADHD can worsen due to sudden change in family dynamics. Ramon. His emotional response often changes and have less control over his feelings and he can't express himself. 5 commendations to the family. Tony must strictly adhere to his meal plan and avoid anything that may shoot up his blood glucose. Karen needs to help him to achieve this by preparing healthier homemade meals. It is important for Tony to eat a balanced diet. Encourage Tony to attend a diabetic support group and offer to accompany him so he may receive support and learn coping mechanisms for his health condition. Clinical weight control therapies could be offered in major centers. Clinical programmers provide thorough evaluation and treatment methods carried out by a multidisciplinary team. People who have significant obesity or comorbid medical issues should particularly consider these programs. Encourage Lucy to join the depression counseling program. Both short-term and long-term cases of depression have shown benefits with counseling or psychotherapy. Motivating Karen and her father Ramon to make sure that patients understand why and for what purpose they are taking their prescriptions. Education is also essential. Ferreira Family Care Plan. Family Health Assessment. Using the tool Calgary Assessment Model was used, which involves major areas of family assessment. Structural. Can be made by using family assessment questionnaires, making structured genograms, performing cultural assessment and understanding roles of family members and extended family and friends for their well-being. Developmental. Can be performed to have a picture of the family in terms of their level on a timeline. Family can be assessed for their respective stages in life, the tasks and duties they perform according to their current roles. And functional. Assessment of various channels of communication, interfamilial influences, role assessment and study of the belief system of the family. Interprofessional collaboration. An effective, collaborative, cohesive team bonding is because of the multiple issues present within the family. Family education. To make solution understandable, the family require proper education of the resources, literature, helpline and role clarification of the interprofessional team members. The main priority would be to help the family in 2 ways. Either they can be supported to adapt to the newer family functioning owing to the role reversal of the breadwinners, or, secondly, they can be supported to find alternative employment opportunities to support themselves. The financial issues are a major concern as it builds up pressure on the adults and deviates their attention from the children who need constant care and guidance from their parents. Referring the family to an employment counselor is a must. Additionally, a social worker can be appointed in this case to work with the family at a closer level. Primary interventions, education and awareness about setting and achieving financial goals. In-depth analysis and therapy sessions for the family to improve relationships. Family group therapy and assessment sessions for understanding the state and effects of interfamilial relationships. Psychosocial intervention for behavioral management of affected children. Tracking medication, health history and maintaining health documentation. This is the end of our presentation. Thank you for watching.